Everyone kindly join the quiz. The link is provided in the YouTube description. Sorry, in the YouTube live comment section. Okay. Just go to the comment section. We have shared the link in the chat section. Also, you'll find the link in JuxtaMed quiz official group on Telegram. Also on Dr. RMD NEET PG Telegram channel. On Dr. RMD WhatsApp channel. Okay. So in these three platforms, you'll find the link of the quiz. So join the quiz first. We are going to start quiz at 10 p.m. sharp. So today we have OBG part 3. And in part 3 of OBG, we'll be covering up uh, medical and surgical complications. So yesterday in part 2, we had obstetric complications. And today in part 3 of OBG, we'll be having medical and surgical complication, which again is one of the most commonly asked topics in OBG in the last 2 to 3 years of NEET PG question paper.
3 more minutes. We'll start the quiz soon.
Guys, we'll be starting the quiz at exactly 10:10 p.m.
Two more minutes to go, guys. Quickly join. Those who are joining late, you can also join the quiz because during the quiz, you can enter at any moment, but you won't be able to answer the questions which were priorly displayed. Okay. So among us is Doc Grove, who was winner of yesterday's quiz, OBG Part 2. I also see other familiar faces, Myra and Saumya, Rakshaya. So these were some of the toppers from previous recent quizzes. I am missing neurosurgeon, by the way.
He is busy with surgeries, some emergency.
Neurosurgeon 30 hasn't joined yet. Also, I think yesterday uh, someone named Chicken Fry had made dramatic appearance.
Yeah.
Was leading the quiz also.
We have Ben Stokes today.
Oh, Ben Stokes. Okay,
I
let's
think we
start.
can start, sir. Yeah.
Yeah. So welcome everyone to another exciting episode of JuxtaMed Quiz. I am Dr. RMD, and today it's all about medical and surgical complications related to pregnancy. Joining me are Dr. Rupal and Dr. Manoj. They'll be giving you some indirect clues along the way to help guide your answers. So make sure you are paying attention. Let's dive into today's quiz.
All right, guys. A 28-year-old woman at 32 weeks of gestation presents for routine antenatal care. Doppler ultrasound of the middle cerebral artery is performed, and the peak systolic velocity is found to be elevated. This finding is most commonly associated with which of the following? MCA artery, and then which is it's going to reflect.
To give a hint, this condition is related to a context of RH incompatibility. Yeah,
Very
So
nice.
right.
so anything that causes anemia can cause elevated MCA velocity. This is even useful in screening for sickle cell anemia also in some places where it is difficult to screen. Even transcranial ultrasound is a very important parameter there. So most of them have answered it right, fetal anemia. Even in young children also we can use this parameter. So VSP is leading today, followed by Hemant, Dr. Reddy and Maila.
Good going, guys. Let's move on to your next question.
A 28-year-old primary gravida at 26 weeks of gestation undergoes screening for GDM using the DIPSI method. Her 2-hour postprandial blood sugar is 75 grams. Okay, it is for 148 mg per deciliter. What is the next best step in the management?
Okay, so I'll give you a little clue. Over here, this results in higher than the cutoff. You can see it's clearly higher than the cutoff, of the normal glucose tolerance, but still meet the full criteria for diagnosis of GDM.
Yes,
Hmm.
so DIPSI criteria is asked again and again. Okay. So you need to know everything about in and everything about GDM. Okay, you can't afford to miss a question from GDM.
That is true. It's been
VSP,
frequently asked plenty of times if you
yeah,
see our previous question papers.
VSP is leading, followed by Hemant, Ashish, Dokro, and 1J. Moving on to the third question. 32-year-old pregnant woman at 28 weeks gestation is diagnosed with bacterial vaginosis, which is the following is the safest antibiotic for treatment.
In case you're looking for a hint, you want to go for an antibiotic that is well tolerated in pregnancy and has a strong efficacy profile against the bacteria causing the infection.
And while you think about the treatment options, remember that this is a common infection and appropriate antibiotic therapy is important to avoid any complications.
Let's see what they got.
Yes,
Perfecto.
so that's correct. Metronidazole. So now Dokro is leading, followed by Ashish, Hemant, Reddy, and VSP.
All right, guys, keep up the pace.
A 25-year-old primary gravida at 34 weeks of gestation is brought to emergency room with generalized tonic-clonic seizures. Her blood pressure is 170 by 110 and urine dipstick shows 3 plus proteinuria. What is the most appropriate initial management here?
Right. And over here, the clue would be the situation is a classic case of preeclampsia, and the presence of the seizure makes it something more severe. What's the first step, guys? Think something that can control both seizure and blood pressure.
Yes,
Wonderful.
it is IV magnesium sulfate first. Okay. Then after that, it will be so the
Guys,
blood
can you
pressure
tell the
also.
regimen used?
Mm,
Yeah.
good one.
Comment in the YouTube live section. We'll give shout out to those who have answered.
All right, guys.
So Doc Crow is
Okay, we
leading,
have the
followed by VSP,
VSP back in the
Ashish,
race.
yeah, Tron and Javed. I think Javed was the one yesterday with longest streak, right?
That was
Yes.
JSN, no?
Yeah, JSN, I
SN.
guess.
Yeah.
Yes. Okay.
You're at the mid of the quiz.
This is the fifth question. 28-year-old preemie, 38 of weeks of gestation, has CPD. Obstetrician decides to perform LSCS. Which of the following is the most common incision used on the uterus during LSCS?
Mm.
I think it's a easy question, but you might get confused seeing the names. Let's see who gets it. There's another name for fan and steel incision.
Insertions and the strength. Mm.
Yes. Majority have answered it right. Leading is VSP now, followed by Tron, Ashish, Aisha, and Javed. Good going, guys. At sixth position, we have Anusha, 7 Dokro, 8 Ben Stokes, 9 Samir, and 10 Mohan. So for the previous question on magnesium sulfate regimen, three of them have answered right on YouTube Live. That is Kalai, I think it's Kalai Vanan, Bola Bola, and Priya. So this is
Yeah.
an important announcement, guys. After this 6 parts of OBG, we'll be having OBG Grand Finale on February 5th at 9 p.m. Okay, and it will be conducted at 9 p.m., not at 10 p.m., the usual time. So there will be exciting cash prizes during this event. First prize will have 25% cash prize. Second prize will have 15%. Third prize will have 10%. Entry fees is only 50 rupees per head. So this quiz will be conducted by a special faculty from OBG. We are not revealing the name. We'll be revealing the name by tomorrow. So the special faculty will be the quiz master for this, and you'll be getting cash prizes for this event. So don't miss. Click on that registration link, the scanner QR code that you are seeing, and you can register directly. Okay. Also, the registration link is provided in YouTube community posts on Telegram channels and also on .rmd WhatsApp channel.
Yes, guys. So your sixth question. If you can see, it's a tricky one. A 30-year-old woman undergoes a routine first trimester ultrasound at 10 weeks of gestation. What is the most likely chronicity of this twin pregnancy?
So, to give a hint, this chorionicity of a twin pregnancy plays a key role in managing the pregnancy, particularly in terms of monitoring for complications like the TTTS syndrome, which is twin to twin transfusion syndrome.
Mm.
Yes, sir, time is up. Yes, it is dichorionic. As you can see in the image, there are two separate cavities with chorions. Okay, so it is dichorionic. One more definition of this is monochorionic. So you need to differentiate this on USG basis. So I think
Yeah,
most of
can you
them.
guys tell us the sign also?
Yeah.
What is the name of the sign?
So mention in YouTube live what is the sign that you can see here. Okay.
Is it Mickey Mouse sign? Is it?
No, it's Twin Peak sign.
Yeah. Okay.
Mickey Mouse, I
Like
think, anencephaly.
encephaly. Got it.
Leading is Ashish right now, followed by Aisha, Dokro, Anusha, and Ben Stokes. So moving on to the seventh question. 27-year-old preemie, 32 weeks of gestation, sudden gush of fluid per vagina, but no uterine contraction. Speculum examination confirms pooling of amniotic fluid in vagina. What is the next best step in management? So
Why
you
do
can
I
say,
think?
yeah, continue.
I think it sounds something like a preterm, premature, or I hope you know that what I'm getting with this. Because, and if you are able to diagnose this, so I hope you know how to prevent this infection or preterm labor. They
Yeah, they
did.
got that right.
Nice.
Yes, it is
Nice.
administered corticosteroids and antibiotics because of the risk of chorioamnitis. Okay, so this is premature pre-term rupture of membrane, PPROM. Okay.
Right.
You can prevent early onset neonatal sepsis in children, in the baby, if you give corticosteroids and antibiotics on time. So Aisha is leading compared to everyone else, and she also has the longest streak, followed by VSP, Benchtokes, Ashish, and 1J. So for this diamnionitic monoclinic sign, two of them, Priya and Polapul, have answered lambda sign. I think that's right. Lambda sign.
Yeah, it's right.
Hmm.
Yeah. Okay. Moving on to the next question.
A 26-year-old woman at 10 weeks of gestation presents with vaginal bleeding and lower abdominal pain. On examination, cervix is open and product of conception are seen at the cervical os. What is the most appropriate diagnosis here?
Well, I suppose these are like the classic signs, and I would suggest an incomplete abortion or something similar. But the fact that the cervix is open and there's some expulsion of products helps us to narrow it down.
Yeah,
Yes, the answer is inevitable abortion.
Hmm.
guys, the product of conception is just seen. It is not expelled yet. So I think you got confused in that.
Hmm.
So Ashish is leading, followed with bench rolls. Like the points are really close, followed by
Up close.
Aisha, Anusha, and VSP.
All right, guys, you're doing perfectly great. Let's keep up the pace. Remember, last two questions, they can hit you up.
30 30-year-old woman at 8 weeks of gestation presents with unwanted pregnancy. She requires abortion. Which of the following is the most commonly used combination of medication? This again is a very important question. Up to 9 weeks for MTP.
So we all know that for medical abortion, we often go with a combination of medication. But here, two drugs are used. So think about progesterone antagonism followed by uterine contractions.
And with this, regime is considered safe and highly effective in the first trimester for those seeking a non-surgical option.
Yes, the answer is mifepristone, misoprostol. Also remember these two names are very confusing, so you need to know the mechanism of action also. That also can be asked. And also the doses also can be asked. Okay, so this is a very important question. This question can also be asked as a match the following question. Okay, so you should be very careful when you go through this MTP.
Right.
So at the end of 9 questions, we have Ben Stokes who is leading. Very good. Followed by Hashish, Aisha, Anusha, Vanji. Last question.
All right, guys, we know it's a cutthroat. Let's be the fastest finger first. The question is, a 32-year-old woman with a history of GDM presents at 38 weeks of gestation for delivery. During the second stage of labor, the baby's head is delivered, but the shoulders don't emerge easily. The total sign is noted. What is the most likely cause of this complication?
So to give a hint, when there's a history of GDM, you often see macrosomia, and that can lead to shoulder dystocia. I think I gave you the answer.
Yes. So we have separate maneuvers also for this. Uh, yeah, the answer is macrosomia. Okay.
Wonderful,
So
guys. So,
the question was, what is the most likely cause of this complication? Okay. So it is not what is this complication. So you need to read the whole question before you
Yeah.
answer. That's a few of them answer shoulder trauma. Shoulder trauma is a complication. But what is the likely cause of this complication? Okay. So that is macrosomia. So we have come to the end of this quiz, and today's quiz winner is Aisha. I think Aisha is the
ooh,
winner for the first time.
Yeah.
Congratulations.
Congratulations.
Congratulations, Aisha. At second place, we have 1G and bench strokes.
All right.
Never knew
Somewhere,
bench strokes
someday.
were good in OBG.
Yeah, dude.
At fourth place, we have Tago, fifth Ashish, sixth RDT, seventh Javid, eighth Docro,
Oh,
ninth Anusha, and 10th VSP. Congratulations, everyone.
Very
congrats,
good,
guys.
guys. Congratulations. We are very glad.
Come back to YouTube Live. Okay, so if you have any doubts regarding today's session, you can text us. So today we completed part 3 of OBG. Okay. Also for this OBG Grand Quiz, we are having an esteemed faculty who is going to conduct the quiz. She will be the quiz master for that. Details will be
Woohoo!
kept as a surprise right now. We'll reveal it to you in next 1 to 2 days. So she'll be conducting the quiz and she'll be handing over the prizes to the winners also. So I guess everyone is preparing for the upcoming OBG Grand Finale quiz. We have received many registrations so far, so be stay well prepared. Okay, you can expect double the competition because everyone is coming prepared. Okay, so if you have any doubts regarding today's session or regarding the Grand Finale quiz, you can text in the YouTube live section, comment section right now.
Yes, guys. We would also like to hear your feedback if you'd like to share any. So do go ahead with that as
He has
well.
asked what is the topic. Topic is entire OBJ. Like we during this 6 days, we'll be covering through all topics in OBJ. So tomorrow also we have a topic in OBJ. Total we have it for 6 days. Okay. So at the end of 6 days, we'll be having one grand finale quiz, and that is the one with the exciting cash prize and a separate quiz master for that quiz. Okay. So you will be having all topics of OBG for that grand finale. Okay. So tomorrow we have gynecology. Okay. Rest of the gynecology that is on January 30. On first day we had sexual transmitted infections, infertility, and contraception as topic. Other than these three topics, we'll have rest all gynecology for tomorrow, and also with the exception of tumors. Okay, tumors we have on February 4th. Other than tumors and the topics covered on January 30, rest of gynecology like general gynecology, fibroids, polycystic ovarian disease, all these things we'll be covering in tomorrow's session. Okay, so tomorrow is the main gynecology part or general gynecology part. So you can get these topics on the Telegram channel and also in the YouTube community post on YouTube channel only. So all these topics are already displayed. Okay. So for tomorrow's quiz, yes, the topic is gynecology except STI, contraception, infertility, and tumors. Okay. Other than this, we'll be covering rest of the gynecology topics for tomorrow's quiz. So Aisha has asked, sir, okay, regarding your question, I think we had discussed it during YouTube live session only just now, the correct explanation for that. So you can go back, rewind the video and you can see for solution. Okay, Dr. Manoj had explained it. Any more doubts? Okay, fine. We'll see you tomorrow, guys, at 10 p.m. With the topic based on general gynecology, except few topics that I've told already. So tomorrow we'll be meeting you at 10 p.m. sharp. Okay, so be prepared. Till then, good night.
Good night, guys.